Hi there, you're welcome to DemiRx Care channel, where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and contents here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DemiRx Care. Thank you and bye-bye. Hi there. So what is our medication of choice today? Our medication of choice today is known as the Human Chorionic Gonadotropin. So this medication comes in different brand name, and the brand name include Ovidrel, Pregnyl, as well as Profasi. So these are all a brand name for what a medication called the Human Chorionic Gonadotropin. So what is this medication used for? So this medication is used to induce or cause ovulation. So this may also be used in patients who are using like an assisted reproductive technology. This can also be known as IVF. So this medication is used to kind of aid that process in patients who are looking to conceive. With this medication, it actually comes in a subcutaneous injection as well as an IM, which is also known as an intramuscular injection. So with the subcutaneous injection, usually patients would take about 250 microgram of the subcutaneous injection given as a single dose, and this is used 1 day following the follicle stimulating agent. So patients will actually take this medication along with the follicular stimulating agent to help improve the chances of being pregnant. Also, in terms of patients who are using the intramuscular type, it ranges between 5,000 to 10,000 intramuscular. It ranges between 5,000 to 10,000 units intramuscularly following the last dose of the menotropins that patients usually take along with this medication. So, like I said, for the earlier subcutaneous dose as well, it's not actually, the medication is not taken alone. It's taken in addition to another agent to kind of help facilitate that chance of getting pregnant. So what are some side effects of this medication? So some side effects of this medication include nausea and vomiting. Also, this medication can also cause injection site reaction, most especially for patients who are injecting themselves. It can cause like a redness, a swelling, or irritation around the areas where you're injecting it. So a good rule of thumb is to make sure that you're not injecting in the same exact spot when you take, if you're taking multiple injections. So you want to make sure that you're rotating the site. I would place a picture of how to kind of rotate, how many inches you need to kind of separate between your injection as well in this video. That way you can have a visual of what I am referring to. So usually with subcutaneous, patient will inject it around their stomach area or around their thigh area. With the intramuscularly, most likely we go for like your deltoid muscle. That's usually how patients are given this medication. There are also some other intramuscular sites that I will also I would also place the visual in this video as well. That way you can see what I am referring to. Also, in patients, this medication, a common side effect of it is ovarian cyst. So definitely you want to make sure that you're letting your doctor know if you do have a history of ovarian cyst. That way they're aware of that, and they're making sure that they're going to monitor that while you're on this medication. Also, this medication can cause some abdominal pain or discomfort. However, when it becomes bothersome, you definitely want to reach out to your doctor and let them know that this side effect is happening. That way they can refer you to another medication or make sure that they're monitoring it to make sure it's not because of the medication, but maybe there's something else that they need to be looking at that's going on with regards to you at that moment. All right, so what is a serious side effect that you definitely want to reach out to your doctor for immediately when you start noticing this side effect? So a serious reaction that is known with this medication will be what they call an ovarian enlargement or hyperstimulation syndrome. So what happens when patients start noticing this syndrome? So patients start noticing consistent stomach bloating or distension, which would be like abdominal swelling. You just feel very gassy and it's very consistent. You definitely want to reach out. Also, if you start noticing any terrible lower abdominal pain, make sure that you're reaching out to your doctor. If you start noticing any severe pelvic pain, make sure you're reaching out as well. If you also start noticing any unusual lower amount of urine, like you're not peeing as much as you used to, and it's just really odd, then you definitely want to reach out to your doctor. As well as if you start noticing it in, immense weight gain, then you definitely want to reach out to your doctor regarding that as well. Usually when it comes to medication, my advice to patient is make sure you're listening to your body. If you're feeling a certain way and you don't feel it's normal, make sure that you're voicing that out. Make sure you're letting your doctor know. That way they're testing, they're monitoring to make sure that this is not because of the medication, and they're ruling out whatever condition they need to rule out while you're feeling this side effect. That way they can get to the bottom of the why. There's this adage that says a closed mouth doesn't get fed. I can definitely relate that to medication. So if you don't tell us this side effect, the doctor assumes that everything is going great and you don't have to worry about it. They don't have to worry about anything. So when you report the side effect, how you're feeling at a certain moment, making sure you're documenting when you're feeling those side effects, that way they can check the consistency of that side effect that you're feeling and kind of relate it back to what is going on in your body. Also, in terms of what to look out for while you're taking this medication, you do not want to use this medication if you're already pregnant. So normally the doctor would check for a pregnancy test before placing you on this medication to make sure that you're not pregnant, because if you're pregnant, then fantastic, you don't have to take this medication. Also, while you're taking this medication, if you're not pregnant yet, if you're taking this medication, you want to make sure that you're continuing your doctor's appointment, making sure that you're going through the proper blood lab work. That way they can monitor and make sure that, everything is going well when it comes to the medication. Also, with this medication, it can increase the chances of you having a twin or more than one baby. So it can increase your chances of having a twin, triplet, quadruplet, whatever your body can handle. But yes, so this medication can increase the chance of that, which is actually great if you've been waiting for a long period of time before starting this medication to conceive. Also, another thing that you want to be aware of is that this medication can increase the risk for what they call ovarian torsion. So ovarian torsion is actually what is known as the twisting of the ovaries, which can be cause blood flow to be kind of cut off to the ovary, which is not good. So you definitely want to make sure, like I said, if you're feeling those side effects that I mentioned earlier regarding the ovarian enlargement or ovarian hyperstimulation syndrome, make sure that you're reporting that to your doctor. Also, you want to make sure that you're limiting your workout sessions while you're on this medication. So if you're the type of person that is going towards, that you're used to doing a rigorous workout session, then you want to kind of taper it down since you're trying to conceive. That way you can allow your body just kind of recuperate. This is not the time for you to start, if that's not what you're used to before, this is not the time to start a rigorous, intense, workout session with your gym trainer or you just in general. So making sure that you're limiting that workout when you're going through that ovarian stimulation process for your body to get ready to conceive. Also, you want to make sure that you're washing your hands before and after injecting yourself with the subcutaneous or intramuscular injection. Also, do not use this injection if you start noticing any weird color changes in the solution before injecting it. Make sure you're reaching out to your doctor. Also, another thing that you can do is you can check for the package insert to make sure that the content inside the vial or whatever you're using has the right color in it. That way you're making sure that the drug is still intact before injecting it in your body. Also, you want to make sure, like I said, rotating the injection area, injection site area, wherever you're injecting, you want to make sure that you're rotating that to make sure that you're reducing the chances of getting irritation in that area. Also, with this medication, you want to make sure that you have a sharps container or a proper disposal container for like sharp objects, because the last thing you want is somebody else injecting, you know, the medication or coming in contact with that medication unintentionally. Also, this medication can increase the risk for blood clots, so make sure that you're reporting any signs of blood clots such as chest pain, abnormal leg pain, leg swelling. So these are all signs of blood clots. If you start noticing maybe like a specific redness in one area and it's kind of like looking like there's a blood pool in that area, make sure you're reaching out to your doctor as well. Most especially with blood clots, this can be very deadly if it travels past the area it's in and, you know, goes to the heart. This can be, you know, another story entirely. So you want to make sure if you're noticing any blood clot symptom, like I said, chest pain, abnormal headaches, if you're noticing any swelling or pain in your leg area, eye ache, make sure that you're reaching out to your doctor regarding that. All right, I hope you were able to enjoy this video and learn one or two things regarding how to take this medication effectively and what you should be seeing when it comes to this medication and what you should not be seeing when it comes to this medication. If you did enjoy this video, make sure you give it a like or a thumbs up, and also make sure you subscribe to our channel. You never know, we might be posting about your next medication. And if you also do have any suggestion regarding a medication that you're taking and you would like for us to talk about the medication here on our channel, make sure you insert the name of the medication below and we'll review it and try to get you, you know, more information regarding that medication. Thank you for watching and stay blessed.